So my specialty area is in behavioral sleep medicine. So what I do is focus on some of the different behavioral factors that might influence their sleep health. I'd say primarily we are seeing patients for insomnia. So oftentimes that's chronic insomnia where the patient has had the sleep disturbance for about 3 months or longer. Although we do see some other types of presentations, so we'll also meet with patients who have hypersomnias, so for example, narcolepsy, type 1 or type 2, or idiopathic hypersomnia. And then we will also work with patients who have a circadian rhythm disorder. So that could be like our shift workers who are maybe working nights and then have to sleep during the daytime, which can be challenging. And then we'll also work with patients who have nightmares. So we do some treatments to help reduce the frequency and severity of those nightmares. In addition to the sleep history, we'll also collect background on mood and mental health history and assess for things that are common comorbid presentations with sleep disturbance. So that could look like depression, anxiety, a history of trauma or PTSD, ADHD. I definitely invite an open conversation to make sure that patients are on board, they have the ability to ask questions and really understand, why we might recommend what we recommend. So I definitely would expect that collaborative discussion as far as treatment planning and approach. We definitely get to know the patient pretty well, get a sense of, the other factors in their life that may be impacting sleep. And I think it's a pretty rewarding relationship, especially when we notice the patient's getting better. When I'm not at work, I can usually be found probably spending time with my husband and our dog. We have, she's a black lab border collie mix, so she's very active. So usually taking walks outside somewhere when weather permits.